Painful respiration, causes and prevention. Painful respiration can involve lung pain that occurs when a person breathes in or out. Infections, musculoskeletal injuries, and heart problems can cause this pain. The lungs do not have pain receptors, so when a person experiences painful respiration, it is not the lungs themselves that hurt. However, conditions that affect the lungs, organs, joints, or muscles within the chest cavity can cause pain when breathing. In this video, we discuss when to get help and the possible causes of painful respiration. We also cover home treatment and prevention. When to get help. Pain when breathing can sometimes be a sign of a potentially life-threatening condition, such as a heart attack or pulmonary embolism. Seek immediate medical attention if the pain accompanies any of the following symptoms: choking, loss or a decreased level of consciousness, chest tightness or pain, especially if it spreads to the arms, back, shoulder, neck or jaw, severe shortness of breath, blue skin, fingers or nails, struggling or gasping for air, excessive sweating, sudden dizziness or feeling lightheaded. Pneumonia. Pneumonia is an inflammation of the air sacs within the lungs. The most common cause of pneumonia in adults is a bacterial infection, but other causes include viral and fungal infections. People with pneumonia often have chest pain that can worsen when inhaling. Other symptoms of pneumonia can include coughing, a high fever, fatigue, shortness of breath. People with symptoms of pneumonia should see a doctor. Treatment depends on the cause and severity of the condition. A doctor may prescribe antibiotics for bacterial infections. Pleurisy. Pleurisy is an inflammation of the pleura, which are the tissues that line the chest cavity and the outside of the lungs. Many conditions can lead to pleurisy, including viral and bacterial infections. People with pleurisy tend to experience sharp pain when breathing. Other symptoms may include pain that may spread to the shoulder blades, chest pain that is worse when coughing or sneezing, shortness of breath, unexplained weight loss. People with symptoms of pleurisy should see a doctor. Treatment depends on the underlying condition. Costochondritis. Costochondritis is inflammation of the cartilage that connects the breastbone and the ribs. The cause of this inflammation is not always clear, but it can sometimes result from a chest injury, severe coughing, or a respiratory infection. Costochondritis typically causes sharp pain and tenderness around the breastbone. People may find that this pain radiates to the back and gets worse when breathing deeply or coughing. Costochondritis often gets better on its own, but people should see a doctor if the pain interferes with daily activities. Pneumothorax. Pneumothorax occurs when air enters the pleural space, which is the space between the chest wall and the lungs. The buildup of air increases the pressure in the pleural cavity, which can cause part or all of a person's lung to collapse. A chest wound, lung injury, or a complication of lung disease such as emphysema or tuberculosis typically cause a pneumothorax. Pneumothorax can cause chest pain that gets worse when breathing or coughing. Other symptoms can include a fast heart rate, bluish skin or nails, shortness of breath, tiredness, chest tightness, flaring of the nostrils. People with symptoms of pneumothorax should see a doctor. To prevent a person's lung collapsing, a doctor may need to remove air from the pleural space. Pericarditis. Pericarditis is an inflammation of the pericardium, which is a fluid-filled sac that surrounds and protects the heart. A wide variety of factors can cause pericarditis, including bacterial and viral infections, injuries or surgery to the heart, certain medications, autoimmune conditions such as rheumatoid arthritis and lupus, rarely cancer. Pericarditis can lead to painful breathing or sharp chest pain that may feel better when sitting upright and leaning forward. People with pericarditis may also experience a fever, irregular heartbeat or palpitations, shortness of breath, lightheadedness or dizziness. Anyone with symptoms of pericarditis should seek medical attention. Doctors can usually treat pericarditis with anti-inflammatory medications. Chest injuries. Injuries to the chest, such as pulled muscles, broken ribs, or a bruised chest wall, can lead to pain when breathing. This pain may occur only on the side of the injury. Other symptoms of a chest injury may include bruising or skin discoloration, pain that radiates to the neck or back, shortness of breath. Chest injuries can result from blows and impacts to the chest, sports injuries, severe coughing, surgery, falls. People with minor chest injuries can often treat themselves at home with rest and pain medications. However, individuals with serious injuries or other concerning symptoms should seek medical attention. Home treatment. Medical treatment for people with painful respiration depends on the underlying cause. However, home treatment may help relieve chest pain and other symptoms. People who experience pain when breathing may wish to try pain medications. Over-the-counter drugs such as ibuprofen and acetaminophen can help reduce pain from conditions such as costochondritis and minor chest injuries. Changing positions. Leaning forward or sitting upright can sometimes help relieve chest pain from conditions such as pericarditis. Breathing more slowly. Relaxing the chest and breathing more slowly may help ease symptoms in some people. Cough suppressants. If symptoms also include coughing, taking over-the-counter cough medications may help to reduce discomfort. Prevention. Preventing painful respiration is not always possible. Conditions that can lead to painful breathing do not always have a clear cause, which makes them hard for a person to prevent. However, some lifestyle interventions can help reduce the risk of infections and other chest problems that can lead to painful respiration. This can include quitting smoking, practicing good hygiene such as regularly washing hands, having an annual flu shot, eating a balanced and healthful diet, doing regular exercise, getting enough sleep.